Okay, I will get us started. So, welcome to our third October and Beyond session for 2025. I'm Krista Thompson. I will be co moderating today's session with my colleague Megan Friesen. So, October and Beyond starts every year in late October and goes through November for 5 sessions focused on different facets of occupational disease. Every Thursday, we have a series of presentations from 12 to 1:30 Eastern. We are now recording this session and it is being broadcast live on YouTube. Those who are attending on WebEx, okay, you will get a chance to unmute to ask a question or type questions in the chat for being asked in the Q&A times. If you do unmute, you will be recorded. So if you don't wish to be recorded, the chat is an option for you there. Also, I'll mention the first 2 Octobers are available on YouTube. So if you want to go back and watch them later, you can do so. Whether you're watching on WebEx or the live recording on YouTube or the recording later, you can turn on automatically generated transcripts to be able to read what's being said. For WebEx, in the bottom left-hand corner, you can find the letters CC in a roughly box shape. That will turn it on. On YouTube, hover your mouse over the video to see the box in the lower right-hand corner. And again, you'll see the letter CC inside a roughly box shape. That will get you your automatically generated transcript, which is hopefully mostly accurate. Sometimes the transcript doesn't quite catch everything. So those who are on WebEx will get a link near the end of the session to request a certificate of attendance for professional development or maintenance points. It is also a survey, so even if you don't need that certificate, if you would at least fill out the survey, that would be greatly appreciated. They will be emailed for those who do request the survey, or the certificates when they do the survey will be emailed in mid-December. So I will turn over to my colleague Megan Friesen now.
Thanks, Krista. Well, November is Lung Cancer Awareness Month. Unique to most cancers, lung cancer is a heavily stigmatized cancer due to its association with smoking and often a perception that it is self-inflicted. We would like to recognize that smoking is an addiction that is hard to quit and that no one deserves cancer. The Canadian Cancer Society, along with Lung Cancer Canada and others, work to reduce the stigma, increase the awareness of the devastation of lung cancer, and also to provide support to patients and caregivers. At OCAL, we support many workers and retirees with occupational lung cancers. We have seen all too well the devastation inflicted on those with lung cancer. And while lung cancer treatments are improving, it still lags compared to many other types of cancer in terms of improvements in treatment outcomes. A big reason for this is because lung cancer is underfunded as compared to many other cancers. OCAL's goal is prevention of occupational diseases, including lung cancer, but until that happens, we hope for better treatment outcomes for those diagnosed with cancer. OCAL's website and the Occupational Cancer Research Center's website both have resources for those wishing to learn more about the occupational forms of lung cancer, and you can find more by searching OCAL and lung cancer or OCRC and lung cancer in your web browser. For those of you on the WebEx, you can find direct links within the chat. IARC, or the International Agency for the Research on Cancer, reports that lung cancers can be caused by over 30 occupational exposures and processes that can still occur in Ontario even in 2025. Examples of some of those agents of interest are asbestos, coke production, nickel compounds, silica exposure, among many others. One prevention activity that OCAL has undertaken is to bring the silica control tool to Ontario. The silica control tool was originally developed by the British Columbia Construction Safety Alliance, and earlier this year, the Ontario version was expanded to include a surface mining exposure version of the tool. We are very excited also to announce today that the silica control tool is now available in French. So workers, unions, and employers in Ontario can get a free account in both English and French for the Ontario Silica Control Tool. If you put in Ontario Silica Control Tool into your web browser, you will find a link that will allow you to sign up for an account. Otherwise, there will be a link provided in the chat. Now on to our first speaker. The Silica Control Tool was co-developed by Dr. Melanie Gorman, who is the first of our speakers today. She is an occupational hygiene researcher and a certified industrial hygienist. She is a health and exposure scientist at the BC Construction Safety Alliance, which is a non-for-profit industry association dedicated to providing health and safety services to the British Columbia construction industry. Dr. Gorman is also an adjunct professor at the University of British Columbia in the School of Population and Public Health. She was instrumental in helping to develop the database and the model that drives the silica control tool, along with Dr. Hugh Davies of the UBC School of Population and Public Health. And Melanie, thank you so much for being here.
Thank you, Megan. I'm just going to share my screen so that you guys can see my slides. Thank you for having me. Again, I know I've presented a lot at this OCOW October event. So thank you once again for having me. I've talked a lot about the silica control tool, the database, how we collect data, what kind of data we're looking for, but I was always focusing on the construction tool. So now that the surface mining tool is available, I thought I could come and talk to all of you about how it works and how it differs from the construction tool. So to back up, I probably don't need to explain this to all of you, but just so that we're all on the same page, I'm just going to do a brief intro to respirable crystalline silica. So as I'm sure many of you know, silica is a naturally occurring mineral that is very common in the Earth's crust. There are different forms of silica that can occur based on the temperature, pressure, conditions. The most common is quartz, which is a form of crystalline silica. There is also amorphous silica, but crystalline silica, it has this, I've got this picture in the top center of my slide of this uniform structure. That's the crystalline structure. So when it is in that form, that is the form that can be hazardous to the lungs. And it's particularly, well, it's only really hazardous in the respirable fraction. So when you inhale, when you inhale very small particles of crystalline silica, they can reach the gas exchange regions of the lung, where they can cause scarring, which can lead to silicosis, and also can cause lung cancer. It has also been associated with some kidney disease and an autoimmune disease. So the way that people are typically exposed to respirable crystalline silica is through any kind of task that breaks up or disturbs materials that contain silica. And materials that contain silica are everywhere because it's such a naturally occurring mineral. Anything that is made through rock, earth, sand, gravel, etc., can contain silica, and often does. So that's why we developed a tool for construction, because it's very common in construction materials like concrete and rock, brick, asphalt, drywall, etc. They all have silica. And mining, of course, is the other major industry where we see a lot of respirable crystalline silica exposure, because they are digging and blasting directly into the earth. And it's so and crystalline and silica, you can't really get rid of the silica exposure, so you have to control it if you're doing these kind of jobs. And then just for a refresher on the silica control tool, it was I originally got involved in this project a long time ago now, in 2014. In British Columbia, the WorkSafe BC, our local regulator, they were implementing new substance-specific regulations for silica, and the construction industry was concerned about basically their ability to comply with the new regulations. It was, you needed to have exposure monitoring data to demonstrate that your controls were appropriate for the activity that you were conducting, and it needed to all be documented in an exposure control plan, a written exposure control plan. And most construction employers are small businesses, don't have hygienists, so this was going to be a challenge. So at the time, I was working at the University of British Columbia, so we partnered with the BC Construction Safety Alliance, which is my current employer. It's a not-for-profit construction safety association in British Columbia, and with our regulator WorkSafe BC, to try to create something that would be scientifically valid and would meet our local regulatory requirements to help the construction industry to basically to access data that they could use to compare their estimated exposure levels to the occupational exposure limit. So what we ended up coming up with was an online risk assessment tool. It was created originally for the British Columbia construction industry. It's based on a linear regression model derived from a database of over 5,000 personal silica exposure measurements from real construction work sites in Canada, the United States, and Europe primarily. And the tool, if you click through it, it creates task-specific silica exposure estimates, both with and without engineering controls. And then at the end, it prints out a written exposure control plan. And as I'm sure many of you also know, since 2023, the silica control tool has been available in Ontario. We partnered with OCAL and also with CCOHS and IHSA to bring it to Ontario. So the Ontario version, it's the same model, the same data, but it's now transcribed into an Ontario regulatory context. And as as Megan said, we've just recently done the French translation, so it's now available in French and English. And if you see down at the very bottom here, oops, sorry, there, now I've circled this. Down here, it says which version, because as of earlier this year, there are now 2 versions that are available. And I've just zoomed in on that which version section, and you can see there is a construction version of the tool and a surface mining version of the tool. So I'm going to talk today about the surface mining version because we've talked about the construction one before. So to give you some background on how this surface mining tool came to be, it was developed by us at the BCCSA in collaboration with the British Columbia Office of the Chief Inspector of Mines, basically our Ministry of Mines. They commissioned this tool, and we also worked with the BC Stone, Sand and Gravel Association. So essentially, a lot of the Stone, Sand and Gravel Association employers, they are also BCCSA members because there is crossover between sand and gravel operations and construction, and some employers they work in both because they're creating the materials that are used in construction. So some employers they were already familiar with the construction tool, and they wanted to have something that they could use for their sand and gravel operations. And in British Columbia, mining is regulated separately from all other industry. Mining is regulated by the Ministry of Mining. They've changed their name several times. I can't remember what their current name is, but basically here's their logo for the Office of the Chief Inspector of Mines. So it's the ministry they regulate mines, and WorkSafe BC, they do pretty much everything else except for federally regulated industry. So the BC Stone, Sand and Gravel Association, they spoke to the ministry and said, we would like to have a silica tool that we could use for our mining operations. And so then we worked with the ministry to put that together. And we also worked with the Stone, Sand and Gravel Association. They provided some of their data to us. They told us, they told us a lot of context about what kind of work they do, what kind of controls they use, and really what they would be looking for in a tool. And the ministry also provided some of their data. They do their own sampling, and so they provided their data. We combined that with the data that we got from the Stone, Sand and Gravel Association members to create an entirely new database focused on surface mining, so mostly quarries. And really the idea in creating this is the same as the construction tool. We wanted to help employers to use existing data and support compliance with the regulation. We wanted something to educate employers and workers, even in the surface mining industry. There are a lot of small employers. There are some very large employers who have, on staff hygienists who regularly do sampling, but there are also smaller employers who don't have the capacity to do that. So again, we wanted to support those employers using the data that's available. It's in British Columbia, it's free to all employers, so really to reduce effort and the cost. And In Ontario, the Ontario version is also free if you sign up for an account through OCAL. And the ultimate goal of everybody involved in this project, from me to the Stone, Sand and Gravel Association, the Ministry of Mines, WorkSafe BC, OCAL, CCOHS, IHSA, all of us have the same goal, which is we want to protect worker health, and that's the kind of that's the overriding goal with all of this. So how does the tool work? Again, this is just kind of an overview of how it works, and it's the same as the silica the construction tool. It's the same. It's a very familiar process. First, you select your work activity, then it assesses the exposure level, then you add your exposure control, it reassesses the exposure with the controls, and then finally it generates an exposure control plan. So I'm going to go through this in a little bit more detail. So here is an example of a surface mining work operation, and here we've highlighted some of the tasks that we might find on the site that are available in the tool. So we've got a quality assurance sampler, we've got a heavy equipment operator, we have somebody working in the control room, and grounds person, and this is a crushing and screening plant. So these are all options that you'll see if you go into the tool. And on the next slide I have, this is the full list of what is currently available in the tool. You'll see there are some grayed out options, and those are activities that we identified that we would like to be able to estimate exposures for, but we currently don't have enough data. So anything that is black, we have enough data right now. We can estimate exposures for those jobs, but for the grayed out ones, we're still collecting more data so that we can add those into the tool. And a note, if you're familiar with the construction tool, a notable difference between this tool and the construction tool is that in the construction tool, it's task-based. So we estimate exposures for the task. And that is because in construction, it's very, the work is highly variable. And research has found that if you estimate exposure for a trade or a job group, it's not very predictive of their exposure level. It's better to do it based on task. But in surface mining, it is quite different. It is a kind of static operation where it's in the same place, people are doing the same thing day to day, more or less. So in surface mining, we are able to estimate exposure by job group. And then if you select one of these options, it will also pop up little definitions of what we mean by that. So if you're a grounds person, that means you're outside performing checks, doing general cleanup and maintenance for 80% or more of the time. It also includes water truck operations. And here we have some more definitions for heavy equipment operation, welding, fabrication. These are just examples. So we have definitions for all of the tasks, all of the job groups. And if you have any questions, if you're not sure where you fit, you can get in touch with OCAL, and I'm sure that they can help you to find the right fit for the work that you're doing. So once you select your job group, then you also select the work area and the duration, not the work area, just the duration, basically. So it's less than or equal to 8 hours or more than 8 hours. And if you select more than 8 hours, it asks you how many hours you're going to be working, how long the shift is, and then it does a shift length adjustment for the occupational exposure limit. And so once you've entered all of your information, then it goes ahead and it does the exposure analysis, where it estimates the exposure level if you have no controls. So in this case, I'm looking at a crushing and screening plant control room operator, and their exposure level is 0.083 milligrams per cubic meter, which is above the exposure limit. And in this case, we've selected more than 8 hours, so that it's adjusted the exposure limit to 0.04, and their exposure level is above that. So similar to the construction tool, we have this dial. We see we're in the red zone. We get a warning. The exposure risk must be controlled. So then we go ahead to add exposure controls. And as with the construction tool, if you're familiar with the construction tool, it is the engineering controls that make a difference to the exposure in our model. We also do have options to select administrative controls like inspections of maintenance, housekeeping, personal hygiene, silica, safety training, work shift scheduling, etc. But those are not going to actually change your exposure estimate. Those are just options that you can have in your exposure control plan and that we recommend, but they're not included in the model. The things that will affect your exposure estimate in the model are the controls. And this is another difference between the construction tool and the surface mining tool, is that in the surface mining tool, the controls, most of them are applied on the entire site level. So in the construction tool, we'll have for this task on your tool, do you have local exhaust ventilation? Are you using wetting with your task? It's not really about the site as a whole. With the surface mining tool, it is, so do you have water sprays and mists on your site? Like, so for your entire operation, are there water sprays and mist at the places where the dust is generated? And do you have water or calcium chloride trucks going around your site suppressing dust? Yes or no? Closed pressurized cab, this is the one that is a little bit more individual. Well, it is the worker in question, are they working in a closed pressurized cab? So these are the only 3 engineering controls that we currently have in the tool. We did look at a few other engineering controls. The data that we had did not demonstrate sufficient effects of those controls for us to include them as options in the tool, but we're collecting more data, and we are hoping to add more control options in time. But currently, the 3 control options these are the 3 control options that you can add. And again, like the construction tool, you see there are these tabs. There's answer, criteria, proper practices, information, and that gives you the that kind of defines what we mean if you're going to be selecting one of these controls. And this is actually this is something that we looked at a lot, particularly for the closed pressurized cabs. And I think that the surface mining tool does a better job than the construction tool of dealing with closed pressurized cabs, because they are a major control that is used in these operations. And what we found when we looked at the data is that you really do need to have an excellent closed pressurized cab in order to sufficiently reduce exposure, to make an appreciable difference in the exposure level. So if you look at the criteria for a closed pressurized cab, it needs to have confirmed pressure. It needs to have, I believe, at least a MERV 16 filter, or maybe it's MERV 12. I can't remember off the top of my head, but there is a criteria of what type of filter is required. The windows obviously need to be kept closed, and the doors need to be kept closed. You need to do cleaning of the cab, and because we did look at different cab options, and if all of those factors were not in place, the worker's exposure was not reduced enough for us to model an effect. So once you select your controls, you can go ahead and estimate your exposure. So we have, in this case, we have selected, I think we selected all 3 controls, and now the exposure level is 0.014 milligrams per cubic meter, which is below the exposure limit and below the action limit. So this is considered an acceptable risk, and the work can proceed, and the worker doesn't need to use respiratory protection in this case. If it was a higher exposure level, if it was above the action limit, or if it was still above the OEL, then we would go to another screen where, if you've seen the construction tool, it's the same. It tells you, if you're going to be using respiratory protection, what protection factor do you need? And it also you can also have an option to add any kind of other protective clothing that you're going to be wearing in your final plan that is printed off. So here, this is just an example of an exposure control plan that we would print off for this scenario. This is just the first page, but this is what it looks like. And it basically just summarizes everything that we've entered in the tool, including the exposure estimates. So it sets out the plan that the employer is going to implement to protect workers from hazardous exposure to respirable crystalline silica dust. And what we always tell regulators is that, you know, it's important to make sure that the employers, they're actually doing what they say they're going to do in the plan, that they have an appropriate plan that actually does match the work they're doing. They've selected the right kind of a job type, they've selected the right kind of plant, they are using the controls the way that we have defined them in the tool. And so that this should be all documented in the plan, and it needs to actually match what people are doing on site in order to be effective. So just to dive in a bit more to how the tool works and the data itself. So this is a much smaller database than what we have for construction. For construction, we have around 5,000 measurements of different control options and work activities. For this surface mining tool, we only have about 270 measurements. And because we are, you know, because we're able to do it on a full site level, a job-based exposure estimates with controls on the site level, we're able to do more with a small data set for this, or a smaller data set. But really, it kind of works the same way as the construction tool. We derive a predictive exposure model using linear regression. So I have my database, I do the modeling so that when I enter the characteristics of the work, the model will allow me to come up with an exposure estimate. So the factors that are included in the model are the job group, either with a closed cab or without a closed cab, the use of controls. And so currently we have water sprays and mist, water and calcium chloride trucks, and the sampling duration. And how does it work? Again, it's similar to the construction tool. As we saw, as I was going through the example, you enter details about your exposure scenario in drop-down menus. And then the equation from the linear regression modeling is used to estimate exposure levels, both with and without engineered controls. And the number that is presented as the exposure estimate, that is the 95th percent upper confidence limit of the geometric mean. That is what the exposure estimate is. So using the model, we can estimate the geometric mean, and then what we present is the 95th percent upper confidence limit around that mean, to take into account the variability in the data. This last bullet doesn't apply because I think this is a holdover from another presentation I did about the construction tool. So in the construction tool, we compare task-based exposure levels to the 8-hour exposure limit, but in the surface mining tool, that is not an issue. These are full shift exposure levels that we are comparing to the full shift exposure limit. So here's kind of a summary table of comparison of the surface mining tool to the construction tool. So for the number of observations, we have a lot more. For the construction, we have 5,000 in the construction compared to 270 for surface mining. The source of the data for the construction tool, we have it's worldwide data that we got from peer-reviewed literature, government and agency reports and databases. We got data shared from industry, and I have an ongoing sampling campaign through BCCSA and UBC that we've collected over 300 measurements to add to the database. OCAL is now working with us to share data. So we have a variety of data sources for the construction tool. For the surface mining tool, because it's newer, all of the data comes from BC mines. We have the data that was shared from industry, from the BC Stone, Sand and Gravel Association members, and from the BC Ministry database. And so that's so far, that is our only source of data, but we're hoping to expand that and add more data as it becomes available. Task or job-based, the construction tool is task-based, the mining tool is job-based. The controls in the construction tool focus on the individual. The surface mining tool, they mostly focus on the entire mine with the exception of the closed cab. The construction tool has been around for 7 more years. We launched it in BC in 2017. The mining tool, service mining tool, is new. It was launched in BC in 2024, and it was a lot quicker to come to Ontario. So the construction tool, it was 6 years between it launching in BC and Ontario, but the surface mining tool we were able to bring to Ontario employers a lot quicker through our partnership with OCal. So as always, I want to end with a call for data. So as you may have noted, we don't have any data yet from Ontario, but we're hoping to get some so that we can expand our tool and make it as applicable to Canadian workplaces as we can. I just have like a reminder here of this screen where you select your job group and all of the activities that are still grayed out. We're hoping to get data so that we can fill those in and make it more like I think what we have right now, these are very common activities. So, and it's the same with the construction tool. We have data for things that are common. We are now looking for data for some of the less common activities. And really what we need for the data is it needs to be a standard sampling method. Usually the data I have is NIOSH 7500. You have to use occupational hygiene best practices like flow rate checking, blanks, etc. I need to have a little bit of information so I know how to categorize the job activity, so I know what type of job activity they're doing when I categorize it in the model. I need to know what controls they're using on sites. For the service mining tool, we want full shift measurements. We don't need any information about the company or personal info. So if you have any data and you want to redact all of that information, please do. I do not need that. And yeah, I'm open to receiving data in whatever way is easiest for anybody who is able to share data with me. And when we do receive data, it's stored on our BCCSA secure server. We can password protect it if that's helpful. And we can password protect your individual files. When we enter it into the Silica control tool database, there is no identifying information whatsoever. And if it's data that's for the Ontario database, we are sharing that anonymously with CWED. That's the Canadian Workplace Exposure Database. It's run from UBC, and so that would be, we would take the data, make sure it's completely anonymous, and then it would go into the CWED database so that it can support research activities in addition to the surface mining tool. And with that, thank you very much, everybody, for your time.
Thank you, Melanie. Now we're going to take the opportunity to open it up to questions. If you'd like to type your question into the chat box, please do so. Alternatively, you can unmute yourself and use the little raise hand option, and you can ask your question directly. Yeah, this is really great, Melanie. Is there just to pose a question? What was there in terms of the BC mining division who was interested in getting this tool developed for their surface mining operations? Is there any thoughts of expanding it to underground mining, or is it really that BC has a lot of surface mining operations and that's really the focus right now?
Yeah, I think that the thought is that the surface mines needed more help. There's more smaller employers in that realm, and so they wanted to support those employers. And also, I think it's also because the surface mines were the ones who were asking for it because they're familiar with the construction tool. Making an underground tool is of interest to me. I think I would need probably a lot more than 270 exposure measurements. But it's a bit more complicated. But certainly, I think that there is a possibility for that in the future. I have obtained some underground mining data, but it does not have the level of detail on controls that I would need to create an underground tool. But as far as I know, at the BC Ministry, they are not planning at the moment to make an underground tool.
That does make sense. Yeah, I get that question sometimes, but surface mining and aggregates, gravel, open quarry pits, those are all activities that, I mean, every province has it. Ontario, I know, definitely has quite a bit of it. What with you can't really build roads without aggregate now, can you?
Exactly.
Well, I'm not seeing now. Yeah, feel free
Oh,
to
we
ask,
just had one show up.
questions.
Yep. We have
Oh,
one
we
show
do.
up in the chat. So, two show up now. Do we use the tool in conjunction with the exposure registry tool that WorkSafe BC has?
In conjunction with the exposure registry tool. I for the surface mining. Well, for surface mining in BC, I don't think so because it would be for the Ministry of Mines. For the construction tool, I don't think so either. I don't think there's any kind of communication. Well, I know there's no communication. Whether or not any individual employers submit their exposure control plans to the exposure registry database, I doubt it. I don't think so.
Okay. So the next question is the same ECP used in industry and mining good for research laboratories?
Yeah. So that would be if you're exposed to silica in a research laboratory, if you're doing research on aggregates or construction materials, that kind of thing. I think probably not because we don't really have any depending on what kind of work activity. If you go onto the tool and if it sounds like the descriptions, the job descriptions match what you're doing in your lab, then you may be able to use it. But I think it's unlikely that it would because it really hasn't been developed with those kind of work activities in mind. So unless you are doing research that's directly related to construction or surface mining, I think it probably would not be useful.
Okay, I've got
Krista, it
oh, do we
looks
have a
like
hand
Tom.
up?
Yeah, Tom has a hand up. Tom, are you
Oh,
able
okay.
to unmute yourself, or do I need to do that for you?
Hi, I can do it. Thank you very much. And my apologies earlier on. What I was talking about was the WorkSafe BC exposure tool for possible exposures. So WorkSafe BC encourages people to use the tool, but most
Mm-hmm.
people have no idea it exists
Mm-hmm.
or to access it. So we weren't sure, is the tool mentioned in your presentation to employers, or is it like part of, hey, by the way, if you think you've had an exposure, here's the online registration, the exposure registry tool. It takes about 5 minutes, 4 or 5 minutes to fill it out. I wasn't sure. And if you
Yeah,
did mention your presentation, I apologize. I'm sorry.
no, that's a good question. Really the tool itself is in its original form, it was geared towards employers rather than workers. So we don't really have guidance in there on what workers can do. I mean, it does have education and general best practices, and I always thought that it could be used for training workers, but it does not have that information at the moment. Although I will have a look at that and see if it's something that we could add, because I think it does have utility for workers to understand their exposures. And I know that that OCAL is encouraging workers to use it for that purpose in Ontario. It has not yet been a big focus in British Columbia, but I think it's a good idea.
Okay, we have another question in the chat. Does the exposure recommendation, so the occupational exposure limit, take into account a person's size? And does the exposure affect someone small differently than someone much larger?
Yes, we know, well, yes and no. So yes, you're correct that there are, big interworker differences related to worker personal characteristics, but no, the tool does not, we don't have the information available in our database to adjust for that within the tool. So they're kind of more general exposure measurements that take into account variability across many workers, and then we present a conservative estimate for exposure across a wide variety of workers.
Okay, there's a comment in the chat from Kimberly O'Connell from OCAL, and she is agreeing that she would like everyone to share the tool and help make it stronger if they have data to give. Kevin Hedges, also with OCAL, is asking, are you considering any quarry types moving forward, like basalt or quarries with higher RCS or respirable crystalline silica?
We haven't yet differentiated between different types of quarries. We just have different types of plants. So we're looking at, washing plants, screening plants, and crushing plants, but we haven't looked at different types of minerals. We don't have the we just don't have the data to be able to differentiate between that at the moment. However, again, if we get more data, that's always something that I love to add more options in the tool whenever I can.
So another plug for more data if anyone has anything they can share. And I think Melanie even really clear that that's definitely something you can anonymize.
Yeah, I don't need to know anything about the employer or the workers, apart from what they're doing and what their exposure levels are.
Okay, so I think I don't see any more questions coming in. So thank you again, Melanie. I always love hearing from you and your updates.
Yeah, thank you for having me.
I'm totally biased, of course.
Again.
So I'll move on to the next session today, our second session. We have the two main sessions for today. So the second one is featuring Tracy Kirkham and Jeavana Sritharan from the Occupational Cancer Research Center. So Tracy Kirkham is currently Associate Director and Senior Scientist at the Occupational Cancer Research Center and Assistant Professor at the Dalla Lana School of Public Health at University of Toronto. Tracy brings experience from previous roles at OCRC, Dalla Lana School of Public Health, and CRCHUM. She holds a Doctor of Philosophy in Occupational Environmental Hygiene at the University of British Columbia. Her research interests include occupational hygiene measurement and control, exposure assessment methods for occupational epidemiology, development of exposure databases for exposure surveillance, and emergency workers exposure. Her recent projects include recruitment for a study investigating respirator use and fit testing with individuals who have beards. And Jeavana Sritharan is a scientist leading the Occupational Disease Surveillance Program at OCRC and an assistant professor at the Dalla Lana School of Public Health at U of T. She holds a PhD in medical science, occupational epidemiology from the University of Toronto, and her doctoral studies involve the use of multiple large population data sets to examine the relationship between prostate cancer and occupational risk factors. She currently leads the ODSP, a unique system of over 2 million Ontario workers that can identify and monitor trends of occupational disease. So Tracy and Jeavana, over to you.
Great, thank you.
Sorry, I'll try to bring these slides up. If I can get it to work again. Is it working? Do you see the slides?
Yep, that's good.
Yes.
Perfect. Go ahead, Jeavana.
Okay, great. Thanks for inviting us to speak today and share some of our work on assessing co-exposure interactions between occupational hazards among Ontario workers for lung and bladder cancer. So we wanted to explain by starting off with what are co-exposures. We know that workplaces are complex environments where workers can be exposed to many different hazards at the same time. Sometimes more than one of these hazards can contribute to the same disease. And when workers are exposed to multiple hazards together that are linked to the same disease, this is known as co-exposures. So these exposures can interact in ways that affect the worker's overall risk of disease. The combined effect of co-exposures may be greater than, less than, or simply different from the effect of each hazard on its own. And we provide an example on the right-hand side that demonstrates the various hazards that an underground miner, for example, may be exposed to, leading to the risk of lung cancer. And so understanding how these hazards interact is important for understanding how it impacts lung cancer among workers. And in our study, we're looking at lung and bladder cancer. So ultimately, studying the co-exposures gives us a more accurate picture of how work environments affect health. It can lead to understanding hidden risks, guide better prevention, and help make sure that workers are properly protected. So we wanted to explain the different interactions between hazards to really, share how co-exposures affect the risk of disease. So here we're showing you 3 bars representing hazard 1, hazard 2, and both hazards together. So the lightest shade of blue here represents hazard 1, and you can see that the risk effect size is 1. And then the medium shade of blue demonstrates hazard 2, which also has a risk effect size of 1, followed by the darkest shade of blue, which demonstrates both hazards together. And so when you add these 2 hazards together, the effect size is 2. And that's what we call an additive interaction. So normally we assume that the risk is additive, but what we're interested in finding out if it's not just additive and if the hazards together further increase or decrease the risk of disease. So the other 3 that you see beside the additive interaction is potentiated, synergistic, and antagonistic. And so these are the different things we're going to talk about today in our results. And a potentiated interaction happens when one hazard that does not normally have an effect on risk of disease, which we indicate with the red asterisk, increases the effect of another hazard, which is hazard 2 in the graph, and when they occur together. And you can see that the impact in the dark blue bar, which is both hazards together. And so in this case, one exposure potentiates or strengthens the effect of the other hazard. The other one you can see here is the synergistic interaction, which occurs when the combined effect of the 2 hazards is greater than each of the individual effects. So they work together to cause more harm than expected, more than additive, and so that you can see here that it appears to be more than an additive interaction with the risk effect size beyond 3. And the last one is an antagonistic interaction, which happens between 2 hazards when 2 hazards reduce each other's effects. And the combined effect is less than expected or less than additive. So when we get to our results, you'll be able to see the different interactions and an example of these. So what did our study aim to do? The overall arching purpose of our study is to better understand and prevent work-related cancers in Ontario. And to do this, we identify 3 aims in our study: to examine exposure to cancer-causing hazards and the risk of lung and bladder cancer among Ontario workers, to determine how different hazards interact to influence the risk of lung and bladder cancer, and then to identify which occupational groups are at the highest risk of disease and exposure. So it's also important to understand where our data came from. So workers in our study are actually identified in the Workplace Safety and Insurance Board accepted lost time compensation claims records from 1983 to 2019. So within each worker record, we have information on their occupation at the time of the claim, along with other work-related information. And so through a series of linkage processes, we then link these workers to the Ontario Cancer Registry, where we have the data from 1964 to 2023. And in this data, we can identify primary malignant cancer cases, specifically for lung and bladder for this study. We do have information on histological subtype as well from the Ontario Cancer Registry, which we'll be using in some of our analyses. So you can see that the years go further back for the cancer registry. And this is really helpful because it allows us to identify prevalent or existing cases versus new or incident cases of cancer. So ultimately for our study, we follow the workers in the WSIB records and identify if and when they're diagnosed with lung or bladder cancer through the Ontario Cancer Registry. And then these are the workers that make up our study. So in our study, we have 2 main outcomes of interest, which are lung and bladder cancer. And to assess the risk for each, we first needed to decide which workplace hazards to evaluate. And so for lung cancer, we based our selection on the Synergy study by Olson et al., which was recently published, and they identified 5 key hazards linked to lung cancer risk. And so we aim to replicate their approach using our own study population. And these are hazards that are well-established causes of lung cancer, So including them serves as sort of a proof of concept, helping us confirm whether our data can show similar patterns or whether these hazards interact with other hazards in the similar ways. Whereas for bladder cancer, this was slightly different because we used evidence from the International Agency for Research on Cancer, and we identified hazards with sufficient or limited evidence of causing bladder cancer. We also carried out extensive literature searches to find additional hazards or hazards that had been studied in relation to bladder cancer in other research. And to our knowledge, there are no previously published studies that examined co-exposures and bladder cancer together, whereas for lung cancer, we were able to follow the synergy study. So how was the exposure for each hazard measured? So we estimated each worker's exposure to each selected hazard by using a job exposure matrix, which provides information on Canadian jobs. And so the job exposure matrix provides us with information such as the proportion of workers in a job exposed to a hazard, how high their exposure is based on different thresholds that are categorized into low, medium, and high, and also how long workers are exposed over a week. We use this job exposure matrix to define a job as exposed or unexposed. And for this, we defined exposed as at least 25% of the workers in a job are exposed to that selected hazard. So we do this by using their job title, which is their occupation. And this was retrieved through their WSIB records. And then this is how we classify if a worker is exposed or not exposed. And then what we do is we evaluate the risk of cancer, so lung or bladder cancer, based on the worker's exposure status by comparing exposed workers to unexposed workers. To evaluate co-exposures, we assessed pairs of hazards rather than looking at each hazard on its own. And so we provide an example here on the right where we're showing you 3 different hazards. So for example, silica, zinc, and lead. And for these 3, we can create all possible pairs. So silica and zinc, silica and lead, and zinc and lead. And then we examine how each pair is related to disease risk. So for each pair, we start by looking at the workers who were exposed to only one of these hazards. So if we're using this example on the right, let's just say hazard 1 is zinc and hazard 2 is lead. So we first examine the risk of disease among workers exposed only to zinc, then among those exposed only to lead. And then next, we examine workers who are exposed to both zinc and lead together to see whether the combined exposure affects their disease risk. We then compare the disease risk from that co-exposure pair, so in this example, zinc and lead together, with what we would expect to see if the effects of the 2 exposures were simply added together. So remember, that's what we called additive interaction. And so we do this, and then finally, we also, conducted statistical analyses to test whether the observed co-exposure effects were statistically significant. So before getting into our exposure analysis, it's also important to look at the makeup of the workers in our study. So our large cohort has about 2.1 million workers, and roughly 64% or 2/3 are male. So this is our overall cohort that we're getting our cancer cases from. And this is the occupational data. So this is expected because this is coming from workplace compensation claims, which have are more common among male-dominated occupations where exposure to hazards tend to be higher. So within this cohort, we were able to identify about 41,000 cases of lung cancer and about 14,000 cases of bladder cancer. For lung cancer, you can see that the distribution of cases by sex is similar to that of the overall cohort, so about 70% male and 30% female. However, when you look at bladder cancer, there are noticeably more male cases than female cases. And I just want to point that out because these sex differences are important and can impact our analyses and our findings, which we'll discuss in the upcoming slides.
Thank you. So I'll take over for a bit now, and I'll be going over some of the cancer risks and the co-exposure interactions that we observed. So I'll start with what was the risk of lung cancer we observed for the 5 independent hazards from the Synergy project. So these included asbestos, chromium-6, which is the more toxic variant of chromium, and nickel, PAHs, which is polycyclic aromatic hydrocarbons, and silica exposure. So in this graph, you're going to see two colored bars. The light colored bar represents the female risks, and the dark colored bars represent the male risks. And on the bottom of the axis is the percent increase, so the increased risk of lung cancer among those exposed to those hazards compared to people not exposed to those hazards. So from an overarching look, we can see that for females had an excess risk of lung cancer for all 5 hazards. And that nickel was the highest risk for females. So females exposed to nickel had approximately a 47% increase in lung cancer compared to women not exposed to nickel. And this was followed closely by chromium-6 exposure. Now, for when we look at males, we can see that the risk estimates are much lower than females. And for example, even with asbestos, we observed no increased risk for lung cancer for males exposed to asbestos compared to not exposed to asbestos. And for males, we found that the highest excess risk was for polycyclic aromatic hydrocarbons, which was approximately a 15% increased risk of lung cancer. So just thinking about this and showing how different the risk estimates were for males, for females, just supports that idea that sex differences is important in understanding the risk of disease in the workplace. Now, I would also mention that these findings were very similar to those that were observed in the Synergy project, which helped validate our findings. So now to go into the co-exposures and looking at what things interacted which may increase the risk compared to those previous risks that were in the last slide. I'm going to use lung cancer, PAH, and silica combination as my example to walk through the methods that were presented in the methodology section. So here we have a graphic where you have the hazard ratio on the y-axis. This is telling us how much risk there is in developing the disease if you're exposed versus not exposed. And we see in the first set of 3 icons, I guess, I don't know what you call them, dots, that's for the male. And then on the right are the set for the females. Now the first symbol is the little blue square. This represents the workers who were, the risk of developing lung cancer for workers who were exposed to PAHs, but not silica. So if we look at that, we can see that the hazard ratio is 1.15. So this represents a 15% increase in lung cancer for people exposed to PAHs only. Now, if we look at the results for silica, we can see that they have an increased risk of 7% or hazard ratio of 1.07. Now, if we want to look at people who are exposed to both silica and PAHs, we calculate that risk and we get a risk ratio, hazard ratio of 1.36. So this is a 36% increase in risk. Now, as you may remember, to look at co-exposures to see is this an additive interaction or more, we add the sum of 1 and 2 together, so the independent risks. And when we add those together, we get 22, so 22% increase in lung cancer risk. And we compare this to what we measured among people who were exposed to both, we get 36%. So 36%, which we observed, is higher than the 22% that we were expecting based on additive effects. And we did run statistical analysis, and this was statistically significant, showing a more than additive or synergistic effect. Now for females, we can see that the exposures are higher, but the pattern is similar. But I will mention that this is a non-significant interaction because of the counts for females are lower. We were unable to reach significance. but the risk, I think, is still there. So now if we want to look at this, we don't have time to go over each box for each pair. So instead, what we did is we put this into a matrix where we have all 5 hazards going down and going across, and then each cell represents a pair. So for example, these are the male results only right now. So we can see here, I don't know if you can see my cursor, but in this top cell where we have chromium and asbestos, we have a plus sign. This is represented in with a plus sign. The plus sign represents additive effects only. And so everywhere you can see where those pairs are additive. Now we did identify 2 antagonistic effects. This included PAH exposures with asbestos and PAH exposures with chromium-6. This was similar to what was observed in the Synergy project as well. Then for asbestos, it's not asbestos, sorry. So for synergistic effects, we observed 3 different pairs that included asbestos and nickel exposure, asbestos and silica exposure, and then silica and PAH exposure, which was the example that I provided in the slide before. So going forward, these synergistic effects really highlight more of the dangerous combinations for workers where we need to put more effort into reducing exposures to prevent excess lung cancer risks. And so going forward, that's just something to think about of where we should be focusing our efforts. Also very good for claims adjudication. Now, when we look at female results, we can see that they're all additive. This is in the top section of the graph. And as I mentioned before, a lot of the patterns were similar, but just due to the smaller cell counts, we were unable to prove statistical significance. And again, this was very similar to the findings of what the Synergy project found. So now if we go on to look at the risk of bladder cancer, we looked at 8 different hazards that were identified in our project. This included aromatic amines, arsenic, chlorinated alkenes, chromium-6, diesel engine exhaust, ionizing radiation, mononuclear aromatic hydrocarbons, and then PAHs from petroleum sources. So here we can see that there were only 4 hazards that we were able to measure an excess or an increased risk of bladder cancer. You will also notice that there is only 1 color of bar. This is because there were too few cases, especially when stratified by sex, that we were unable to look at sex stratifications. So these bars represent all workers. And so we can see here that for arsenic, we had around 25% increased risk of bladder cancer among workers exposed to arsenic compared to workers not exposed to arsenic. And then also the next highest risk was for PAHs and petroleum, and mononuclear aromatic hydrocarbons and diesel engine exhaust were a little bit less. Now, the problem also with this is not only were the case counts low, but for some of these, like for example, the chlorinated alkenes, the aromatic hydrocarbons, the exposure prevalence, or how many people are exposed to these agents, is also smaller, which led to more issues with the identifying co-exposures. So we are going to be looking at investigating new exposure methods. So if we go to look at the interactions for bladder cancer, now here are the 8 different hazards in the same graphic, but now this is not male results, it's all results. You will see a new symbol in here, which is a lighter grayed out box. These cells represent pairs where we were unable to calculate co-exposures due to the small counts. And as I mentioned, this was more prevalent of an issue in places where we had lower exposure prevalence. So that was especially for like arsenic, radiation, and chlorinated alkenes were the bigger ones. So from these results, we can see that most that were calculated are additive. We did find one antagonistic exposure, that was diesel engine exhaust with mononuclear aromatic hydrocarbons. And then we did find one synergistic result, which was with chlorinated alkenes and mononuclear aromatic hydrocarbons. This was particularly interesting for our group as there hasn't been any publications yet looking at co-exposures for bladder cancer hazards. And so now comes to the point of how do we use this information to make it useful for workers and workplaces, and to be more practical. And so I think focusing on these synergistic effects is probably one of the key starting places, and identifying where and who is exposed to these co-exposures, which may increase the risk. So to do this, we've been looking at different ways that we can identify high-risk groups. And I'm going to use the bladder cancer synergistic effect that we just mentioned above. In this graphic, what I have is a scatter plot where each job is plotted based on the proportion of jobs exposed among mononuclear aromatic hydrocarbons, which are on the y-axis, and then workers jobs that are exposed to chlorinated alkenes, which are on the bottom. And inside of this graph, we have a dotted line, which represents 25%. So you may remember from the methods section, we said jobs where more than 25% or more of the workers are exposed, we consider an exposed group or exposed job. And so when we plot this and we do that, the group at this top quadrant then becomes our high-risk groups. So worker groups that are exposed to both the mononuclear aromatic hydrocarbons and the chlorinated alkenes. Now that we've identified that there's 5 different dots in here, we're interested in like who are these dots? So if we go in and look at this, we can add that information in. So here we have, aircraft mechanics and repairmen, rubber and plastic laborers and fabrication, assembling and repairing. Again, rubber and plastics molding operations, so more in rubber and plastics, metal machining foremen, and dry cleaning. So going forward, there would be a good idea to put more effort and invest more investigation into these groups to help reduce exposures to these combination of hazards. And going forward, we will be also looking at, it may not be just the prevalence that's important, but also the intensity of exposure. So how high of an exposure level people are exposed to, or how long people are exposed to. So some people may be exposed to a very low level, but for a very long period of their work shift. So maybe they're exposed to 30 hours a week at a low exposure level. Or maybe it is exposure at a high exposure level, but for a shorter period of time. So we'll be looking at incorporating those other measures to identify high-risk groups. One good, I can't think of the right word, but a benefit of this, I guess, is that we chose 25% here, but people could change this and move slide the prevalence threshold up or down and to be smaller or larger, and then either increasing or decreasing the capture of the high-risk groups. So for example, if we decided, oh, well, we're only interested where there's at least 50% of the jobs exposed for both, then we would see that we would only end up with one high-risk group. That would have been the aircraft mechanics and repairmen. Oh, or potentially we would expand it, and then there would be a larger number of jobs in this high-risk group. Oh, sorry. So what are the key takeaways? I think the key takeaway, one of the biggest key takeaways is that we were successful in identifying how co-exposures interact for lung and bladder cancer among Ontario workers in our cohort. And this gives us like the confidence that we can apply this for other outcomes as well. We did also find that the findings varied highly between males and females, which continues to support our claim that all our analyses or analysis whenever possible should include sex differences to ensure that males and females are protected. And then understanding how co-exposures interact helped us design better prevention and control strategies. So we're hoping that those ideas of having those graphics where we can identify high-risk groups would be useful and practical for people in the field. And we are open to get feedback on what people would like for that type of graphic. And Jeavana, are you gonna?
Okay, great. Yeah. Yeah, so today we just wanted to give you a flavor of what we're doing, and it can get quite complex when we're presenting many different results. But we do have a number of things that are ongoing or our next steps for this project. So we are working on identifying the specific occupational groups and industries where co-exposures exist for lung cancer and for bladder cancer. And so, this will it'll really complement the work of identifying co-exposures. And then you saw the previous example where we could do this for bladder cancer. We've also been working on additional analyses to adjust for cigarette smoking. And this has been, we can do this using physician billing records that indicates if workers were recommended for tobacco cessation by their physician or sought help through their physician. And so we're exploring whatever data sets we have available to kind of fill those gaps. We're also exploring other exposure data to potentially identify other hazards of interest that our current job exposure matrices can't evaluate, and just various methods to improve the exposure data that we do have. And we're also working on preparing scientific papers for publication. And as Tracy mentioned, really disseminating our work through knowledge translation and exchange activities and in forms that are usable by workers and others in the public. And just to end off, we'd like to acknowledge our wonderful project team members, our collaborators, our project advisory committee, which is made up of our system partners and knowledge users, and our project funders. So with that, we'll end it there, and we're happy to take any questions. Thank you.
Well, thank you so much, Tracy and Jeavana. That was a really great presentation. Yes, we are open to questions. Feel free to put them in the chat, or alternatively, please raise your hand and you can unmute yourself and ask the question live. But as we're waiting for questions, I just wanted to say I like the way that you highlight there's the continuous work to identify those differences between the sex-based differences, males versus females. And I was impressed to see that you even had 30% data for females for lung cancer, less for bladder cancer, but that's still, it's making great strides in terms of being able to find those differences between the two sexes. All right, and taking a look in the chat, keep in mind to receive a certificate of attendance, please click on the link that has been just dropped in the chat. And yeah, Krista, what did you find interesting in the bladder versus lung cancer? That's so interesting.
Well, I think it's important to, something that I learned when I did my master's in occupational environmental health was the potential for additive and synergistic effects. But outside of that, when I'm in the real world talking to clients, they often aren't aware that things can be additive or synergistic. And yes, I remember learning on paper antagonistic could happen, but I'd never encountered anything with that either. So just understanding these different interactions, I think, is really important for understanding occupational exposures.
I think too that a lot of times people in their training are told about this, and in the field, you as a hygienist, you're supposed to be using the mixture formula for TLBs, for example. But I think a lot of people just don't understand when to use that.
Yeah.
And so even for cancer, which is a slightly easier because you can use the IARC monograph to see which things cause the same cancer outcome. I think people don't use those resources or are not quite sure. So it's important to really highlight these interactive effects, especially the synergistic ones, for the workplaces and make it more, what's the right word? Usable.
Mm-hmm. Definitely. I've used the mixture calculation before and had people say, "What is this? We've never seen this before." So you're right. It's not really used that often. And for those who aren't occupational hygienists, that's just a way of taking the exposures and kind of putting them together into one calculation, because the different exposures may have different limits, so that you're comparing all of them together. Not seeing any questions in the chat, so I'll give one last call. Anyone with questions, feel free to unmute or put anything in the chat.
And for those of you who attended last week and heard the WHMIS updates or information from Chris Shepard, something to keep in mind, WHMIS is always in the works. We have a WHMIS 2015, of course, aligning with the GHS system, and also something to keep in mind in terms of when looking at to even start identifying the potential for any kind of additive effects, let alone synergistic, is are the ingredients and what's being used, what is the product that worker has in their hands, and what compounds, chemicals are they working with that could then potentially interact. But I mean, that's something that we all think of. Oh, here we do have a question. So let me take a look here from Rachel. In future, would it mean women workers should have different levels of respiratory PPE than men? Oh, that is a good question. What do we think, Tracy, Jeavana?
I think that opens a different can of worms of the whole issue with PPE not fitting women as well as men as well. So that's a very complicated question to answer. And I think maybe, yeah, Jeavana, do you have any?
Yeah, there's a lot to unpack when we see the sex differences in such a large cohort because of the makeup being high hazard occupations. But yeah, there's a lot of potential reasons for why we're seeing that, and this could be one of them. So I think that first identifying that we are seeing these sex differences is important, and then being able to kind of push for understanding why we're seeing those sex differences.
Mm-hmm.
I would also say it's not just about respirators or PPE, because as most people here are probably aware, that PPE is the lowest level of protection, and we would want a layering effect for controls. And maybe it just means that there are extra controls for women for certain situations. And maybe we use administrative controls about reducing them hours of exposure. There are other ways that we can reduce exposures other than use personal protective equipment.
The only ones I can think of now have to do with pregnancy and risk to the fetus with lead and radiation. There might be others that comes to mind, but that would provide a model for if certain extra cautions were required, more than just pregnancy, but at all times if we did find those sex differences.
Mm-hmm. I mean, ideally, we would want to reduce exposures across the board, but
yeah. You know what? Let's aim for that.
Yeah, and this is a fairly new area, so there aren't other studies on bladder cancer and co-exposures that have been published that we've been able to identify, and then synergy. So it would be great to have more evidence to support it. Yeah.
Definitely.
But if I can do a plug right now, since it looks like we have a minute or two, and we've brought up PPE and respiratory protection, I am doing a fit test study for the Synctata technique. This is a technique which uses a physiotherapy elastic resistance band that covers the bearded area and is tied at the top of the head, which may allow bearded men to wear respirators. And this is a study that's being funded from the Ministry of Labor, Immigration, Training, and Skills Development. And we are currently recruiting. We did limit this first study to sick men, so sick or Sikh, depending on how you pronounce it, of working age. And they can have any facial hair, and they can wear a turban or not wear a turban. So it's very flexible. So even some men who have several day growth, and we have a very wide range of beard lengths and densities going on. So it's good to have a variety. So feel free to reach out at OCRC, and we would welcome any participant. And we are able to travel across the province. So especially if you're a workplace and you have people in your workplace who may be interested, we are more than willing to travel to your workplace and do testing there. We have done this already at another workplace, so it did work really well. That's the end of my plug.
That's exciting. Definitely. And I see, Jeavana, you put the
I added
link
it in the
there
chat.
in the chat, so that's perfect. I'll get my words out. So for those who are on WebEx and can access the chat, that is there for you. If you are watching this in a way where you can't access the chat, you can just put it into your browser, it'll pop up. I will just also mention that we have heard that some people watching WebEx on their browser aren't able to access the chat. And if you are looking for a certificate of attendance, you can contact OCOW if you can't get into the chat. Just head to the OCOW website, go to contact us, and just explain that you're looking for that web link, and one of us will get back to you within a day or so. I'll say we'll try to do it as fast as possible, but I won't guarantee you won't have to wait, one business day. Okay, so we're going to wrap it up there because I'm not seeing any other questions come in, but I've really enjoyed today's sessions, both of the presentations. So thank you to Dr. Melanie Gorman and also to Drs. Tracy Kirkham and Jeavana Sritharan from OCRC for your time today. For attendees, your final reminder that link is in the web chat. If you are looking to provide us with feedback, that would be lovely. If you're looking for a certificate of attendance, that's how you can request it. So please email us using the website contact form if you are on WebEx and you're unable to open that in the chat.
And next week, on November 20th, we will have our 4th session for October and beyond 2025. The theme for the session is combating underreporting in occupational diseases, featuring our very own Dr. Sarah Rhodes, along with OCRC epidemiologist Dr. Nathan DeBono. After that, our week 5 session and the last of the series will focus on protecting vulnerable workers and will be moderated by our OCOW project manager, Eduardo Huesca. Hopefully you can attend the remaining 2 sessions. And thank you again for joining today, and have a safe rest of your day.